So you've got long COVID and you feel like crap. We're talking about the 3 things that you need to know to stop your long COVID symptoms, including anxiety and panic attacks. If you're new here, welcome to this growing community of people who are ready to heal their anxiety, depression, long COVID for good. I'm Carrie Bailey, your functional nutritionist. I work with people with anxiety, depression, and other weird mystery symptoms, and I help them heal. Whether you've been diagnosed with long COVID or you've been experiencing long COVID symptoms for weeks, months, or years, we're talking about the 3 key things you need to do to start getting better. Let's explain a little bit about what's happening when we have long COVID. So what's happening is that COVID is a virus, right? Well, it triggers other underlying viruses that are in our body. Maybe we had them as a kid throughout our life, and maybe they went dormant or we thought they went away, but they're there. And that viruses are being disturbed by COVID. The system in your body that gets hit the hardest by these resurrected viruses is your nervous system. One of the biggest, most important nerves in your body is your vagus nerve. And this is a cranial nerve that runs from your head to the organs in your body. It helps communicate to them. So this cranial nerve, this vagus nerve, for instance, goes to the heart. And so if you're experiencing heart palpitations, it could be that your vagus nerve is inflamed at that point. If you're experiencing coughing or breathing problems, that could be the vagus nerve portion that's going to your lungs. The vagus nerve also controls your small intestines, your liver, and your stomach. So if you're having digestive issues, it could be that portion of the vagus nerve. Your nervous system inflammation can cause system-wide panic attacks. Anxiety and panic attacks are a big problem in long COVID because your nervous system is under attack, because that communication, not only of the vagus nerve, not only runs from your head to the organs, but it also runs from the organs back into your head, can cause inflammation, which interferes with your neurotransmitters. By the way, I've got a recovery guide that's going to help you with this. This guide will help you with steps to control not only long COVID, but also anxiety and depression. So go to the description below and grab your free copy. The other system that's working really hard during long COVID is your immune system, which we talked a little bit about before. Your immune system is trying to protect you. It's fighting these viruses, but there's so many viruses, it might not have the resources to protect you from all of them. So what we need to do is boost the immune system through diet, supplementation, and herbs. So one way for you to look at your immune system to see how it's working is to look at your blood work, to look at a CBC with differential, also called a complete blood count. This is something that you can get from your doctor, and it includes your white blood cells and your red blood cells counts. And if you look at your white blood count total, if it is high, that means you have an active infection and your immune system is working hard to fight it. Now, if that number goes to the low side, and I'm talking about functional medicine ranges, not the conventional ranges from your lab. But if it goes to the low side, then that means your immune system is working really hard for a long time and it's now suppressed. But you can't look at white blood count in total by itself. You also have to look at the other white blood cells like neutrophils, lymphocytes, monocytes, basophils, and eosinophils. This is going to give you a better picture of what's going on. So viruses, for instance, can cause elevated or low neutrophils and lymphocytes. And so you're going to want to look at those ranges and see if they're out of, again, the functional medicine range. Are they too high? Are they too low? I see this a lot in clients that have had long time chronic viral infections where their lymphocytes might actually be low, the neutrophils are high, and then the rest might be normal. So it's important to understand what's going on, as well as the complete history, of course. There's 3 key things you need to know to stop the symptoms of long COVID. 1 is food, 2 are herbs, and 3 are supplements. So let's get into those. Food. The most important foods you can bring in your body are green foods, green vegetables, asparagus, leafy greens, and broccoli. As many of those as you can get in your lunch, your dinner, bring them in as much as possible. The next thing you want to bring in are your herbs. These are parsley, cilantro, thyme, ginger, garlic. These are all going to be very healing for you. So let's talk about the ways to use these herbs. With thyme, you can sprinkle thyme on your food. I love thyme on chicken, but you can also take the thyme. You can take 2 fresh sprigs of thyme and put it in some hot water and let it steep for like 15 minutes. And you can drink that. You can add some honey to it. That's a great way to get that in. Now, if you really want to do a therapeutic dosage, you could take that thyme tea And you could drink it every few hours throughout the day for a few days. That's going to really help your body, give your body the boost of nutrients from that herb. Now, the way to get turmeric and ginger in, I didn't talk about turmeric before, but the way to get turmeric and ginger in is if you go to Trader Joe's and some other stores, will have like little shots of turmeric and ginger, and you can drink those shots, or you can get turmeric and ginger, garlic, different things, and juice them yourself and drink that down as a shot. And you can drink that throughout the day as well. Now, the third herb I want to talk about is raw garlic. I love raw garlic, and there's a couple, I'm going to tell you some ideas of a couple ways to use it. You can put the raw garlic and make dressing, salad dressing, put it on your leafy greens that we talked about before. So this raw garlic, you can mash it up, crush it up, mince it, whatever you like. Then you're going to put it in with some lemon juice, not vinegar. Lemon juice is much better. And then you're going to put it with either olive oil, avocado oil, whatever your favorite non-seed oil is. Now you can use that as a dressing to put on your salad. You can also top your salad with parsley and cilantro, or make it into the dressing. Now, the other way to use raw garlic is to make sort of a chimichurri. And chimichurri is awesome because you can put it on meat or vegetables or anything that you want, like more of a hot dish. So you take the raw garlic. So if you're going to make a traditional chimichurri, I would say swap out the vinegar for lemon juice. That's going to be a better choice for you. And it will change the flavor somewhat, but it'll still be a more nutritious way to get that in for you. So you're going to grind up like parsley, cilantro, garlic, some either lemon or lime juice. And you can put that again, you can put it in the food processor and put that on all kinds of foods and drink that, eat that every day. All right, the third thing we're going to talk about are supplements. So there's a few supplements that are key here. One is N-acetylcysteine, also called NAC. It helps your body make glutathione, and glutathione is the most important antioxidant in your body. So in order for you to fight anything, your immune system needs glutathione. NAC also, or NAC, also thins mucus. So if you've got chest congestion, anything like that, it's going to thin the mucuses. Now, it's important that you exclude dairy from your diet. Take the dairy out, because the dairy will always create mucus, and you're going to be going up against your NAC. NAC is also anti-inflammatory. It helps your body fight inflammation. The next one is zinc. Zinc is a super important mineral that your immune system really needs. Your white blood cells really need the zinc. Zinc has been sort of depleted in our soils, and also people aren't necessarily eating enough zinc-rich foods. And so in order to get enough zinc, you're going to need to supplement. The form of zinc that I really, really like is zinc sulfate. It's a combination of sulfur and zinc. And sulfur is really important for a lot of factors in your body, your ability to detoxify and things like that, and for your immune system. So zinc sulfate in a liquid form is what I recommend. And the third supplement that's very important to bring in to strengthen your immune system is vitamin C. Vitamin C, you've heard about, I think I've heard about since I was 12 years old. So yeah, vitamin C has been around for a really long time. Vitamin C is also going to help protect your neurotransmitters. So remember, we were talking about the anxiety and panic attacks. Bringing in that vitamin C is going to not only fight the inflammation, it's going to help your neurotransmitters. 99% of the vitamin C's out there are ascorbic acid. And I don't like ascorbic acid because it's very harsh, acidic. If you take too much, it can cause loose bowels. And it's usually made of corn. And so I want to try to avoid that as much as possible. And I want to bring in a buffered vitamin C. So buffered vitamin C doesn't have ascorbic acid in. So you read the labels for sure. The buffered vitamin C is mixed with calcium and magnesium to kind of tampen it down. It's a sorbate, a calcium ascorbate and magnesium ascorbate. So you want to look for that, as well as natural forms of vitamin C. Those are great too, like acerola cherry, or camu camu. There's a lot of really natural ways to get vitamin C. The key is getting enough, right? You have to eat a lot of camu camu to get the vitamin C that you need. Here's a pro tip. If you've been sick for a really long time, the best way to do is do a therapeutic dosage of vitamin C and zinc. And what that looks like, and you're going to do this for like 1 to 4 days. And what that looks like is you're going to drink what you would normally take in a daily dosage of zinc. You're going to take a daily dosage every 3 hours. And then for vitamin C, you're going to take a daily dosage of vitamin C every 2 hours. So you can do that throughout the day. And you can do that again from 1 to 4 days to really give your body the boost that it needs, especially if you have long COVID. And you can do that same type of therapy if you've got getting the flu or the cold as well. I'd love to hear your thoughts and comments below. Please share this video with anybody you know who's struggling with long COVID. Thanks for watching. I'll see you next week.